ਹਰੀਓ ਵਿਧਾਨ ਸਭਾ ਦੇ ਵਿੱਚ ਵਿਰੋਧੀ ਧਿਰ ਦੀ ਲੀਡਰ ਐਂਡਰੀਆ ਹਾਵਰਥ ਦੇ ਵੱਲੋਂ ਇੱਕ ਵਾਰ ਮੁੜ ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਹੋਮਸ ਦੇ ਵਿੱਚ ਜਾਨ ਗਵਾਉਣ ਵਾਲੇ ਬਜ਼ੁਰਗਾਂ ਦੇ ਪਰਿਵਾਰਾਂ ਦਾ ਮੁੱਦਾ ਚੁੱਕਿਆ ਗਿਆ, ਜਿਸ ਤਹਿਤ ਉਹਨਾਂ ਪੀੜਤਾਂ ਦੇ ਸਵਾਲ ਸਰਕਾਰ ਦੇ ਅੱਗੇ ਰੱਖੇ ਤੇ ਮੰਗ ਕੀਤੀ ਕਿ ਡੀਹਾਈਡਰੇਸ਼ਨ ਦੇ ਨਾਲ ਮਰਨ ਵਾਲੇ ਬਜ਼ੁਰਗਾਂ ਦੀ ਜਾਂਚ ਵੀ ਕੀਤੀ ਜਾਏ। ਇਸ ਦੇ ਜਵਾਬ ਦੇ ਵਿੱਚ ਗਵਰਨਮੈਂਟ ਹਾਊਸ ਲੀਡਰ ਨੇ ਆਖਿਆ ਹੈ ਕਿ ਸਰਕਾਰ ਦੇ ਵੱਲੋਂ ਇਤਿਹਾਸਕ ਨਿਵੇਸ਼ ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਹੋਮਸ ਦੀ ਹਾਲਤ ਸਹੀ ਕਰਨ ਦੇ ਲਈ ਕੀਤਾ ਗਿਆ ਹੈ।
There are hundreds of families and residents of long-term care watching across Ontario today, and they're demanding answers from the Ford government. And so we've offered to put their questions to the government today, and hoping on their behalf and our own that the Premier and the Minister of Long-Term Care will answer those questions. And the first one is from Sherry Coulson-Hutchinson in Wyerton, and Sherry says this: I've been watching with horror how this government has ignored conditions in long-term care homes even after the military said that residents were dying not just with COVID, but because they were dehydrated, starving, and lying in their own urine and feces. So on behalf of Sherry and so many others, Speaker, why did the Premier break his promise of justice and a full investigation of those deaths from neglect and dehydration?
To reply, Government House Leader.
Thank you very much, Mr. Speaker. As I've said on a number of occasions, not only for Sherry, but for all the people of the province of Ontario, Mr. Speaker, we certainly were put on the defence during the first phase of this battle with COVID, Mr. Speaker. That is, of course, why even prior to the pandemic, we began to reform the long-term care system in the province of Ontario. We began renovating those outdated homes that still had ward beds. We put in thousands of additional spaces throughout the province of Ontario. We knew that there was also an issue with staffing in the sector, Mr. Speaker. That's why we began a study into the staffing. What were the issues that were being faced? Of course, we increased pay. We knew that pay was an issue. We increased pay for the PSWs through pandemic pay, Mr. Speaker. That work continues not only before but during and after. Obviously, when we had vaccines, despite the shortfall in the early months when we had vaccines, the very first people that we vaccinated were those people in our long-term care homes. There is a lot of work left to be done, Mr. Speaker, and we will continue that work for future.
ਸਾਡਾ ਹਰ ਇੱਕ ਪ੍ਰੋਗਰਾਮ ਦੇਖਣ ਤੇ ਸਾਡੇ ਨਾਲ ਜੁੜਨ ਲਈ ਸਬਸਕ੍ਰਾਈਬ ਕਰੋ ਚੈਨਲ ਪੰਜਾਬੀ ਤੇ ਨੋਟੀਫਿਕੇਸ਼ਨ ਲਈ ਬੈਲ ਆਈਕਨ ਵਾਲੇ ਬਟਨ ਤੇ ਕਲਿੱਕ ਕਰੋ।